Let me ask you a question. When you hear the word trauma, what comes to mind? Hey y'all, I'm Dr. Andréa Michel, and I am a developmental psychologist and a trauma-sensitive certified coach and consultant. And today I want to talk to you about what trauma is, how it affects us, and why it is critically important to understand it from a developmental perspective. So, back to my first question. What comes to mind when you think of trauma? Most people think of something extremely catastrophic like war or abuse or some sort of life-threatening accident. But the truth is, trauma is much more than what happened to you. Trauma is what happened to you and what happens to you afterwards, and how did the people around you respond to that thing that happened to you. And lastly, trauma is about how our bodies respond to the thing that happened to us. Okay, just to make sure we're all on the same page, let's talk about what exactly trauma is. Trauma is an emotional, psychological, and physiological response to an event or multiple events that really overwhelm our ability to cope at that time. So, as I said before, it's not about just what happens, but how it impacts our nervous system, our sense of safety, and our overall development. Said another way, trauma is what happens when something really scary and dangerous or overwhelming happens to a person, to us, and it's too much for our brain and our bodies to handle all at once. And so it comes from things like accidents, like violence, like bullying, like losing someone you love, or even being treated badly, neglected, or abused. And so when you experience trauma, your brain goes into survival mode to protect you. And that's when you get into fight, flight, or freeze. So I can't say this enough. Trauma is not just about what happens to you, or it's not just the event itself, but it's the impact on the individual. And also remember this, what is overwhelming to one person may not be overwhelming to another person. That's why two people can experience the same thing, and one can walk away being traumatized and the other can walk away, I don't want to say just fine, but they can walk away without having experienced the incident as a traumatic experience. It's also important to remember that trauma is not a one-size-fits-all type of thing. There are different types of trauma, and let's just really briefly talk about 4 types. 3 of them I'm sure you've heard of. The other one, there's emerging research on it, so you may not know that much about it. But the first type of trauma is acute trauma. And this is a response to a single, highly stressful event like an assault or a car accident. And then there is chronic trauma. Now, this is the result of like repeated or prolonged exposure to distressing situations like ongoing abuse, racial discrimination, or living in the war zone. The third type of trauma is where I spend a lot of my time. Is developmental trauma. And this happens during critical periods of growth, often in childhood. I specialize in childhood trauma. When a person experiences ongoing neglect, instability, attachment disruptions, invalidating environments. And lastly, the fourth type of trauma that I think is important for us to know and understand is intergenerational or transgenerational trauma. And this is the trauma that happens in generations before us, and that trauma is carried through from one generation to the next. And so when we think of things like survivors of the Holocaust, when we think of things like the Africans who were enslaved here in America, that is transgenerational or intergenerational trauma, meaning the incident didn't happen to me, but it happened to someone, my ancestors, and that was passed down from their generation to me. One of the most important things for us to remember as we consider and think about trauma is that it's not just in your head. right? Dr. Bessel van der Kolk wrote an entire book, The Body Keeps the Score, and showed us how trauma lives in our bodies. Our nervous system responds to trauma in a way that is designed to protect us, but sometimes these responses get stuck in the body. And I mentioned earlier the survival mode, the fight, flight, or freeze responses. And depending on where you're reading, sometimes they call it, there's a fourth response, fawn, right? That trauma activates the body's survival instincts. That's that back part of your brain. That's the survival part. This front part is the prefrontal cortex. This is where executive functioning happens. And when you experience some trauma, when you go into survivor mode, all of the energy goes back here. I know you can't see where I'm pointing at, but you get it. It goes back here and the prefrontal cortex shuts down. And so you don't really have the ability to reason, to analyze, to think. Your body pretty much goes into automatic mode, which is you're either going to fight your way through it. You're going to run your way through it, which is the flight. You're going to freeze, just become paralyzed, or you're going to completely shut down and oftentimes, maybe sometimes disassociate from the experience, right? And so it's important to understand that when we do experience trauma, as I said, the amygdala, which is the brain's fear center, it goes into overdrive. And again, the prefrontal cortex, that completely shuts down. It goes offline. And this is why trauma survivors might struggle with memory, decision-making, and emotional regulation, okay? Lastly, I mentioned already, the body keeps the score. Trauma isn't just a memory. It's an experience that gets stored in our bodies. And this is why people with unresolved trauma often experience chronic pain, tension, or even autoimmune issues. Because trauma is more than just in your head. It is all in your body and it gets stuck. So you may be asking yourself, Dr. Michel, why does this matter? Well, if you give me a minute, I will tell you why. Just kidding. But it matters because trauma impacts every area of our lives. It impacts our relationships, our work, our vocation, our self-perception, and even our physical health. But the good news is that trauma can be healed. You can heal from your traumatic experiences. But here's the deal. Understanding trauma is the first step to healing. When you recognize that trauma isn't just about the past, but how it continues to show up in your life and live in your body, then you can approach it. You can approach your healing with more compassion and more grace, not just for yourself, but for others. So, what can you take away from all of this? A couple things. If you don't remember anything that I said, remember these things. Trauma is not just what happens to us, but it is also how it affects us. And remember, trauma can be acute, it can be chronic, it can be developmental, or it can be trans or intergenerational. And trauma affects the brain and the body in ways that go way beyond just our emotions. And finally, and this is most important, finally, healing is possible, but it starts with you having the awareness and compassion and acknowledge that this is what happened to you, that you have experienced trauma. Okay. So if this video resonated with you, I would love for you to leave a comment and share your thoughts with me. And if you found it helpful, make sure you like it. Make sure you share it with someone who you think may benefit from it. And just know, this may be the first video that I'm really talking about trauma, but I'm going to be doing several other videos that really dig into trauma, what it looks like, how it affects us, how we can heal. because this is my area of expertise. All right, I look forward to hearing from you.